Welcome back to Docshala. So today our topic of discussion will be electric pulp testing. So let us now see a question from dental text. So the question is, a patient complains of a slight toothache that has been on and off for a week. So the tooth in the question is number 18. So number 18, it is given in a universal system. So let me now tell you what number 18 is from universal system. So can anybody say what is number 18 from universal system? As you know, in the universal system, we number tooth from 1 to 16 in the upper arch and 17 to 32 in the lower arch. So this one is upper right third molar. Okay, and this 16 is upper left third molar, and this 17 is lower left third molar, and 32 is lower right third molar. Okay, so our question in our tooth in question is 18. So 18 is lower left second molar, right? So which of the following teeth would be optimum to use as a baseline? So the options given are number 19 virgin. So this is number 19. So this will be lower left first molar, right? And number 15 primary cavitation on occlusal. So 15 will be upper right second molar, upper left second molar. So it will be upper left second molar. Then number 3 full gold crown. So number 3 will be upper right first molar. So upper right first molar. So number 30 occlusal amalgam. Then number 30 occlusal amalgam will be lower left first molar. Okay, so you are now understood what all the options are, right? So let us now look at the question. So electric pulp tester. So this is the device which we use for testing the pulp. So this we can find it in normal clinical practice. So what it does is it checks the sensitivity of the tooth by stimulating nerve endings with a low current and high potential difference in voltage. It checks the nerve endings with low current and high potential difference in voltage. So you need to remember this. Okay, so to check the normal baseline values, use it on adjacent non-pathological tooth and compare it with the tooth in question. So in electric pulp testing, as you all are aware, what we do is when we have a tooth in question like this, we check it on adjacent tooth. So this is a pathological tooth in question and this is the control tooth. Okay. Coming to the electric pulp tester, as we have seen, it uses electrical stimulation to stimulate A delta fibers in the pulp. It stimulates A delta fibers. So there are two kinds of responses that it produces. So one is positive response and the other is no response. A positive response is seen when there is vital sensory fibers are present. That means when the tooth is vital. A negative response or no response is seen when there is pulpal necrosis and when there is non-vital tooth. Okay, so and again the responses are divided, like this positive response are divided into three. So three types. One is normal. So normal response indicates that it has the same neural excitation as that of the control tooth, and an early response indicates that the diseased pulp threshold is less than the control, and a delayed response indicates that the diseased pulp threshold is higher than the control tooth. Okay, and coming to false responses that it gives, we have both false positive response and a false negative response. So a false positive response is seen in gangrenous necrotic pulp and in multi-rooted tooth. So anybody have any idea why the pulp tester gives a false positive response in a multi-rooted teeth? So the multi-rooted tooth, like excuse me for my diagram, but a multi-rooted tooth looks like this, right? In most of the cases, in when there is a pulp, I mean there is a pathology, maybe the tooth might have caries only in this half. This half might be carious, right? The So this half might be carious, but this part may be vital. So when we test on this tooth and when we keep the tester over here, it shows a positive response. That means it shows a vital tooth. But the problem is there is a negative, like caries also, necrosis also associated. So in this cases we get a false positive response. And where we get a false negative response? When there is extensive calcification of the pulps, then there is fibrotic pulp, and in cases of recent trauma. Okay, so one important thing which you need to know is it does not provide information about vascular supply of the tooth. Okay, I hope it is clear now. Coming to the reliability of the electric pulp tester, as we have seen that it shows false positive response in few and false negative response in few. And in general, I mean on a broad basis, we have seen which all provide false positive response and which all does not provide a false negative response, right? So let us go on to the procedure. So procedure is as follows. Describe the test to the patient. First of all, make the patient sensitized to the test. Okay. Then check your pulp tester functioning. Okay. Then isolate the tooth in question along with the adjacent teeth. Okay. Then apply an electrolyte on both the control and the testing. Okay. So first of all, as we have seen before, control tooth is tested first. Okay. Then retract the patient's cheek or lip away from the electrode with free hand. Introduce minimal current first. Okay. And slowly increase it, asking patient to indicate when tingling or warming sensation occurs. Record the result according to numeric scale. So record the result according to the numeric scale. So this is how it so the most important things which we need to remember while doing electric pulp testing is never wear gloves during EPT. So gloves should not be worn. Why? Because it gives a false negative result. Okay, medical history of cardiac pacemaker is an absolute contraindication. When the patient is having a cardiac pacemaker inside him, do not perform an electric pulp testing. Okay, do not use it for a concussed tooth. Okay, then response to EPT in various conditions of tooth. Acute pulpitis, lower than normal current. So normal is the control tooth. Okay. Hyperemia, lower than normal but higher than in acute pulpitis. Okay. Pulpal necrosis or abscess, there is no response as we have seen before. So only we see response when the pulp fibers are vital. So we see the response during acute pulpitis, like when no lower than normal current is being supplied to the tooth, the patient will experience a warming or tingling sensation, and even in hyperemia, but a higher current, like a higher than acute pulpitis condition, we'll see the warming or tingling sensation. And when there is pulpal necrosis or abscess, there will be no response. So when the patient is experiencing these positive responses in this both, like even he's experiencing warm or tingling sensation, we can see that pulp is still vital. Okay, this means that pulp is still vital. Okay, and when there is no response, there is necrosis or abscess, which definitely requires an root canal treatment. Okay, so coming back to our question, so as we have seen, the patient complains of slight toothache that has been on and off for a week. The tooth in question is number 18. Which of the following teeth would be optimum to use as a baseline? Here the baseline means control tooth. So for control, what is that we use? So from the above explanation, let us go by option. Number 19, virgin. So number 19 is very adjacent to number 18 and it is virgin. Virgin means nothing but it is vital. Okay. Number 15, with primary cavitation on occlusal. See, we have seen that this is 1, this is 16, this is 17, 18, 19, right? So this is the tooth in question, and when we come to 15, will we use this 15 tooth as a control tooth? No, right? Because that is not adjacent to the 18. What all adjacent teeth we have? We only have 17 and 19, right? So from this only we can easily answer the question. The correct option from this is number A, that is number 19, virgin tooth. Okay, apart from that, when you are not able to, like, if you don't remember this universal system while exam, if you are not able to concentrate on this, you can also derive the answer from the other options. Like, these are the tooth numbers which he has given, right? If you don't remember these tooth numbers, you can just see this: virgin, primary cavitation on occlusal, full gold crown, occlusal amalgam, right? So we know that while doing an electric pulp testing, the control tooth should be vital and it should be free from caries. Okay, and it should not have any restoration. Okay, it should be a natural tooth. So primary cavitation indicates that it is a carious tooth, right? This is a restoration and this is also a restoration. So from this also you can derive the answer that it is number A. Okay, so this is how you can derive the answers for the question. Okay, so if you like our video, subscribe to our YouTube channel and